You're watching this video because a doctor wants you to understand what's involved in drainage of a subdural hematoma. This is surgery to drain blood and blood products from the surface of the brain. A subdural hematoma is a collection of blood or blood products that has formed between the surface of the brain and its outermost covering, the dura. A subdural hematoma occurs when a blood vessel in the space between the skull and brain is damaged. This can be due to a head injury, which may even seem minor at the time. Blood slowly escapes from this blood vessel, leading to the formation of a blood clot known as a hematoma. The collection is usually liquefied old blood that has been collecting for some time. However, it may be fresh or even a collection of old blood with some fresh blood mixed in. This collection usually builds up and exerts pressure on the brain and may damage it. It may occur on one or both sides of the brain. A doctor has recommended drainage of a subdural hematoma. This is surgery to drain blood and blood products from the surface of the brain. After positioning on the operating table, some hair may need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will vary depending on personal requirements. To begin, the surgeon will make a cut in the skin of the scalp. A special drill is used to make a hole in the skull. It's designed to stop if it reaches anything soft. The incision and bone window may vary in size, shape, and position, depending on your personal requirements. There may be more than one incision and hole on each side of the brain that needs treating. The tough lining around the brain, known as the dura, is then opened to reveal the collection. The surgeon will then carefully remove as much of the blood clot as possible. There are different techniques and equipment that may be used to achieve this. There may be membranes within the clot that prevent it all coming out. However, the surgeon will try to safely clear as much of the blood out as possible. The brain may expand immediately or over the subsequent hours and days. To finish, the surgeon may leave or replace some of the removed bone. They may partially or completely cover the defect with a metal plate. The healing process will fill some of the gaps left behind, but there may be a permanent small bump that can be felt. This is usually, but not always, covered up by the scalp and hair. A wound drain may be left on the surface of the brain or over the skull to drain any excess fluid over the next day or two. The surgeon will then close the scalp with sutures or staples. A wound dressing and head bandage are usually applied. Please ask your surgical team for your personal post-operative plan after the procedure has finished, so they can give advice based on your needs. When considering whether to have a procedure or treatment, you should consider the potential benefits, the potential risks, and whether there are any alternatives available, such as medication, radiotherapy, less invasive procedures, or even not doing anything at all. You should take time to ensure you've considered all of this carefully. Between 1 and 5 in every 100 patients suffer from minor or treatable complications from this surgery, such as infection, which is when bugs get into the wound. You may need antibiotics to treat it. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. There may be further bleeding into the same area of the brain. This may require further surgery. Seizures or fits, which are a sudden uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that reduces seizure activity. Headaches. Some patients suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need a drain or another operation to fix it. Hydrocephalus, which is a buildup of fluid within the brain. This may require a drain to be inserted during the operation or at a later date. Pressure on skin, nerves, or eyes. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain operations can cause strokes in up to 5 out of 100 cases, but can be higher, depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problem caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. Medical or anesthetic complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as blood transfusion or further surgery. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.